So who are the women at risk? Women who have never breastfed, women who have a family history, women who've been smokers, active or passive, women who have had issues with their parenting or are nulliparous who have never had children at all. With the flat of your palm, you go into the axilla and feel for any lump on either side. And then with your hands, you go to the nape of the neck and feel for any node if you do. For any reason, if you feel anything abnormal, please do not panic, but come to the hospital and get yourself imaged. The beauty of a sonography is it's only sound waves that are going up or penetrating into the tissues, and they're giving you certain images to show whether there's any abnormal mass there or not. And if you find anything abnormal over there, then we get a mammography done, which is compressing the breast between two X-ray plates and taking an image. Your first sexual debut introduces you to almost 70% of human papillomavirus infection, which gets aborted by the body by our own natural immunity, but part of the strains or few strains that remain over there remain dormant at the cervix with your first sexual debut and with each new sexual partner, and that is how they start harboring infections over here, which can slowly and steadily grow into cervical cancer. In order to prevent cervical cancer, the government and the health boards worldwide are advocating the HPV vaccine, and we do know in India also the HPV vaccine is soon being or is already being introduced. So what does the HPV vaccine do, and in how many doses is it to be taken? Hi, I am Dr. Ranjana Dhanu. Being a gynecologist and a consultant in different corporate hospitals for the past 30 years, I think it's my duty as a clinician and as a doctor to now impart knowledge to my population at large to understand what their usual problems could be and how they should be taking care of themselves. So I'm going to start this entire series for patient education, and the first video today that I'm going to impart to my population at large is to make them understand, the female population, as to what and how they should be taking care of themselves as women. So we do know in the pandemic how important health issues are and how we should be monitoring our health annually. Primarily, I'm just going to tell women what are the different issues that girls or women normally face. So let's start with malignancies, because that's the most scary bit. So if we go by the usual occurrence or the highest incidence, we do know that the breast cancer is the most highly ranking cancer in the world today. So who are the women at risk? Women who have never breastfed, women who have a family history, women who've been smokers, active or passive, women who have had issues with their parenting or are nulliparous who have never had children at all. So all these women are at a slightly higher risk, but still a woman, in spite of having kids, in spite of not being a smoker, active or passive, is also at a certain risk. And what are the tests that she should do? So first and foremost is self-breast examination. Very simple. In the morning, once in 15 days, bear yourself in front of a mirror standing with your hands on the hips and check for the level of both the breasts. If you see a slight discrepancy in the size, it's because the right breast is slightly larger than the left in view of the muscle behind the right breast being large in right-handed women. Then you palpate the breast and check whether there's any abnormal lump or any puckering of the skin on any sort on either breast. Then squeeze the nipple and look for any discharge. With the flat of your palm, you go into the axilla and feel for any lump on either side. And then with your hands, you go to the nape of the neck and feel for any node if you do. For any reason, if you feel anything abnormal, please do not panic, but come to the hospital and get yourself imaged. Now, what do you mean by imaging? So there are ways in which you can kind of image with certain techniques. So that is a sonography and a mammography. The beauty of a sonography is it's only sound waves that are going up or penetrating into the tissues, and they're giving you certain images to show whether there's any abnormal mass there or not. And if you find anything abnormal over there, then we get a mammography done, which is compressing the breast between two X-ray plates and taking an image. So if we combine the efficacy of a mammography along with a sonography of the breast, it's almost 96%. For a mass to get palpable manually takes a long time, But if you do a sonography along with a mammography, you can pick up lesions even smaller than the size of a little millet, and that is what could help in having a longer longevity and a longer lifespan if any disease is detected early. So that is what I have suggested about the breast, and for any reason, if you find any lesion, the clinician will let you know what exactly needs to be done, because there are ways in which you can go in with a fine needle aspiration and look at what the issue is, or an excision biopsy in a very suspicious lesion. And in cases which you need to go further, where the gradation of the mammography is either BI-RADS 1, 2, 3, 4 or 0. So 1 and 2 is fine, but 0, 3 and 4 BI-RADS category needs to be evaluated. So there is where we advise a patient an MRI of the breast, wherein there are breast cups that are put on a patient and she undergoes an MRI. So MRI is magnetic resonance imaging, very easy, no pain. You have to just go through the scanner and we get to know what the nature of the lesion is, and accordingly she can be treated. So that was quickly a little pressy about breast problems. Now we come down to issues in the pelvis, because we're only talking about malignancies so far and gynecological malignancies. So now quickly I have a little model over here, which is the uterus, the tubes, the ovaries, the cervix and the vagina. So this part of the uterus, which is the cervix, dipping into the vagina, is the most common as far as gynecological cancers or genital cancers are concerned. So anytime I go to any, or suppose a Tata Cancer Hospital, and I ask the matron what is the, or any hospital like a Sloan Kettering abroad, they will always say that all over we see cervical cancer yet having the highest predominance. So what are the risk factors for cervical cancer? This is not genetically related, unlike the breasts or the ovaries or the uterine body. So this is not related genetically, but is related or is directly connected to the age of the first sexual debut, the number of sexual partners, your immunity, whether you have habits like smoking or any other habits, and whether you've been vaccinated by the HPV vaccine or not. Your first sexual debut introduces you to almost 70% of human papilloma virus infection, which gets aborted by the body by our own natural immunity, but part of the strains or few strains that remain over there remain dormant at the cervix with your first sexual debut and with each new sexual partner, and that is how they start harboring infections over here, which can slowly and steadily grow into cervical cancer. So the treatment for cervical cancer is first to have a very clean behavior, not indulge in too many sexual partners if possible, get a pap smear done once in a year. Why? Because a pap smear is a test which is cheap, easily accessible, with a good diagnostic accuracy, and is available at all OPDs or outpatients. Now we have liquid-based cytology, which is even better, which is being practiced now almost wherever LBC or liquid-based cytology is not available, wherein we just take some discharge from here and put it in a liquid. The brush goes in, the cytobrush goes into a liquid and goes for check. That gives us a better diagnostic accuracy about the fallen off cells or exfoliative cytology. I want to keep this as simple and lucid for people to understand what it entails. In order to prevent cervical cancer, the government and the health boards worldwide are advocating the HPV vaccine, and we do know in India also the HPV vaccine is soon being or is already being introduced. So what does the HPV vaccine do, and in how many doses is it to be taken? So if it is introduced to a girl before her first sexual debut, it almost offers 100% protection against cervical cancer, and that is why the health authorities are advocating it from 9 to 45 years of age. So any girl at 9, if she takes the vaccine, and if she is going to be having her first sexual debut sometime in her teens later, this is almost going to offer her 100% protection. So most of our patients now are taking this vaccine or giving it to their children as a pediatric vaccine. And of course, for those girls who've been introduced to it for the first time, so maybe they're 27 or they've been sexually active in the past or they're not yet married or they've had their kids, they're 35, even 40. So up to 45 years is the limit. Do not think it's not going to be efficacious for you at the age of 27 or 28. I don't know where this comes from, but let me make it very clear. Anybody from 9 to 45 years can avail of the HPV vaccine in 3 doses, a 0 month, which is the day she takes it, then after 2 months and after 6 months. Now, suppose a patient takes the vaccine the first time and the second dose, probably she gets pregnant or she's traveling, because there are so many times when my patients come to me and say, Doc, my daughter is going to university, so can I give her the vaccine at 0, 1.5 months and 3 months? No, your body requires that time to develop that immunity, so you can take it later. So you have, it can be 0, 2.5 months or 3.5 months, 6 months, 7 months, but it can't be earlier. Suppose for some reason a girl takes the vaccine and cannot take the second and third because she's either pregnant or she has some issues health-wise, otherwise, she can always take the second and third dose later. She does not have to repeat the entire course, but it's always better for all girls to be vaccinated against by the HPV vaccine in order to reduce the incidence of cervical cancer. So with that, my viewers, we have finished talking about the breasts in brief and talking about the cervix. Now let us come to the third, which is a more dreaded condition, but lower in incidence as compared to the breasts and cervix, but that is the ovaries. Now if you see these ovaries, these are like two small cashew nuts lying in a shopping bag, which is your abdomen. Now the tricky thing about the ovaries is until they grow to a certain size or they actually turn to a stage 3 disease with a lot of fluid in the abdomen, which is called ascites, they don't really clinically manifest. So that is the danger about ovarian disease, where it manifests late. Suppose there's a problem in the breast, the woman will come saying, I feel a lump, or I feel some discharge, I feel puckering of the skin. If there's something with the cervix, a girl will come saying, I have postcoital bleeding or I have abnormal foul smelling discharge. But the problem with the ovaries is there's no presenting symptom. Why? It's because if these two cashew nuts become the size of a small lemon, or from the size of a lemon to the size of 2 tomatoes, or from the size of 2 tomatoes to the size of 2 muskmelons, there's not really a much of a bulge in the abdomen felt. So they just feel, oh, it was this seasonal, or I indulge in this food and I feel a little bulge, but there's no pain, there's no nothing. It's just like dyspepsia or a little bit of bloating. And what hits you hard is when the disease has progressed and when it starts to build up fluid in the abdomen, that the woman starts to feel that, oh, I probably have an issue. And when they go and do a sonography, it's rather late. So what I advise all my patients after 35 is to get a sonography of the abdomen done once in a year in order to detect that the ovarian size is absolutely normal. We have ovaries of any size. They could be maybe anything about 4 or 5 centimeters needs to be watched. So what you could do is, if you find an ovarian cyst in the ovary, do not panic. Repeat a sonography after a month if it's a clear cyst in order to see whether it disappears. There's no need to jump into surgery immediately. When you get a decent sonography report, you know exactly what is worrisome and what is not, and accordingly you're going to be treated for the same. I'm going to be taking detailed videos about each malady later and how to handle ovarian cysts or cervical lesions or breast lesions, but today my talk is purely introductory in order to get this entire thing to you in a basket in order to make you understand how you should be taking care of yourselves. So with that, I insist that you should get a sonography done. God forbid if it shows anything abnormal, there are certain blood tests which we can do in order to check the nature of the cyst. So it could be either a CA125 or the HE4 or the Roma index along with the CEA, and these are all going to tell us when we image this along with an MRI again to see whether there's any problem in the ovary, and accordingly we handle it. The beauty of endoscopic surgery or minimal access surgery, which I specialize in, and I'm a robotic and a laparoscopic surgeon, is that we have removed cysts as large as like 11-liter filled cyst in the abdomen, which I'll share in my subsequent videos, through keyhole. But that's the beauty of minimal access surgery, only after seeing that this particular lesion is not cancerous, because there's no place for endoscopic surgery or minimal access surgery in handling cancerous lesions of the ovaries. Coming to now the uterine body. The uterine body cancer is the least occurring amongst all the different cancers, which means the breast, the ovaries, the cervix, because this usually manifests in the perimenopausal age, wherein a woman could say that she has excessive bleeding. Any patient with heavy bleeding in the perimenopause should be treated with the highest degree of suspicion and not be put on certain hormonal tablets. One has to rule out what the problem is with the histopathology. So if your body signals with abnormal bleeding, get a sonography done, check your uterine lining, check whether you have any sort of a polyp, and get it addressed immediately. Do not try to smother it with hormones, because you will not find what your original picture is. What are polyps? Polyps is just a thickening of this pink lining. If you can zoom up, this pink lining which thickens up, and suppose I have more fabric, it is going to fall into folds. So similarly, if I have this lining thickening up a lot, it's going to fall into folds, and that's exactly what a polyp is. If not addressed early, it can lead to problems. If it is a hormonal polyp for any reason, if it's a fibroid polyp, it needs excision if it's giving any problems. Endometrial cancer usually is seen in older patients, postmenopausal. So I typically have a patient saying, oh, my mom, she attained her menopause around 10 years ago, doc, but suddenly I'm finding her having some sort of bleeding. She woke up in the morning, she went to the loo and she's seeing bleeding on the pad. This is something which is an ominous sign. Do not say, oh, let's wait for 3 weeks to see whether she bleeds again. Address it immediately. Go see your clinician, go see your gynecologist, get a sonography done, get an endovaginal sonography done, wherein a probe goes into the vagina, you get a better resolution of the uterine lining, and any thickening more than 3 to 4 millimeters in the postmenopause needs to be addressed immediately. So with this, what you could do is kind of diagnose all your problems at the earliest and see to it that you can keep any sort of diseases at bay. So today, my talk has been purely about looking into different sort of malignancies in your body and how you should be taking care of yourselves. In the later videos, I'm going to be talking about a holistic approach about your diets, about how you should be taking care of your exercise, and then we come to individual problems. So I'm going to have a series of videos now for you for different ailments as well, and that's when you will be more and more educated. So with that, I welcome you, and I'm always going to be here to give you the latest information and how you should be taking care of yourself. Thank you.